Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Zoledronic acid. Its brand name is Reclast. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Zoledronic acid. We'll then touch on an example of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here will be the mechanism of action or how this medication works. So Zoledronic acid is a member of the bisphosphonate class and inhibits bone resorption. It blocks the osteoclastic resorption of mineralized bone and cartilage through its binding to bone. This includes osteoclastic activity and skeletal calcium release induced by various stimulatory factors released by tumors. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of osteoporosis or Paget's disease. Multiple myeloma may have a place for this therapy, as well as hypercalcemia of malignancy. As well, bone metastasis of a solid tumor may also be treated with zoledronic acid. With respect to contraindications or reasons we would not be able to prescribe zoledronic acid, well, we first wouldn't give this medication to a patient who had a hypersensitivity to zoledronic acid or to any other component of the formulation. If a patient had a creatinine clearance less than 35 mils per min, they would also not use this medication due to an increased risk of liver failure. If a patient had hypocalcemia, they would not use this medication. This would be low calcium levels, as well as a patient who had acute renal impairment. Now for an example of dosing with zoledronic acid. So in the treatment of osteoporosis in men, using the brand Reclast, we may see 5 milligrams intravenously infused over no less than 15 minutes, given once a year. When dietary intake of calcium and vitamin D is insufficient, adequate supplementation should be provided to the patient. As well, the patient may have an option to use Tylenol or Advil for post-dose influenza-like symptoms. As with all medications, there are some side effects or adverse reactions that patients may experience while using zoledronic acid, so we'll go over some of those here now. 7.5% of patients may experience abdominal pain, while a weight decrease may happen in 16% when using the dosing for bone metastasis. Peripheral edema may happen 3 to 10% of the time, and 6 to 25% of patients may experience constipation. 5 to 8% may experience diarrhea, and up to 22% may experience a loss of appetite. 5 to 17% of patients may experience nausea, and vomiting comes in between 2 and 14%. Arthralgia or joint pain comes in at 3 to 23%, and back pain at 3 to 18%. Asthenia or abnormal weakness may happen to 2.5 to 10% of patients, and dizziness up to 18%. Insomnia may happen up to 15% of the time, and fatigue up to 17%. Some more serious side effects would be hypocalcemia, or low calcium levels, atrial fibrillation, drug-induced renal or kidney failure, as well as osteonecrosis of the jaw. Alright everybody, that's all we're going to talk about today with zoledronic acid, or Reclast. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.